UR Medicine Home Care provides really services across the spectrum of home care, starting with home nursing, Meals on Wheels, infusion services, wound care, all the way through to hospice care. Personalizing hospice care is so important, and the key is really communication. Everybody comes together and comes up with a plan that allows us to meet these needs as much as we can, and it's a dynamic plan. It's not about dying, it's about living, even when time is limited.
The beauty of hospice care is the team approach. We're approaching the journey of death and dying from all aspects. It's a really well-orchestrated symphony.
So volunteers are really essential to the operations of hospice. We have, of course, some dedicated programs like We Honor Veterans, and then we have people who are just providing that human element.
My sister and I had experience for both my mom and my dad with hospice. The staff with hospice allowed my sister and I to be daughters versus caretakers. Before my mom passed, it was her birthday, and the hospice volunteers wanted to recognize her birthday. So my sister said, well, Mom really loves lemons, so how about a lemon meringue pie? That is just a wonderful gesture by them, and we both love to bake, and we said, well, we can do that. And so I started my volunteer work with recognizing hospice patients' birthdays, and it's been really a very fulfilling experience for me.
Both my parents were on hospice when they passed. My wife passed in 2018, was on hospice. So hospice is obviously very dear to my heart. The We Honor Veterans program has been a very important part of my life. I went to Vietnam, 4 years in the Air Force. In reserves, I served 17 years. To be able to open up to somebody else, the fact that I also am a service member is helpful for them and actually for us too. There have been instances where the family says, we never heard this story before. And we look at it as much as for the family as it is for the veteran.
When we care for people in their home, the care can be much more personalized and it can be much more compassionate. I think for caregivers too, it is, again, such a gift to be able to provide this kind of support and love and care to somebody who's dear to you.
I've seen both sides of the benefits of hospice care. I've been talking about it and working in it for 15 years, and this last year I've experienced it from a personal level. My father-in-law, Steve, was diagnosed with Parkinson's disease about 13 years before his death. And I think through the years, he really fought against the physical debility that the disease brought with it. Wearing my palliative care hat, I could see that we were going to need a lot of support as this disease progressed. I always tell my patients and families that the second you become the caregiver, the family dynamics change. So it was really important for me to preserve my role in the family as the daughter-in-law. And not be the clinical consultant.
One of my favorite recipes to make is my mom's cheesecake. And so that to me brings special meaning. And there was one patient where I delivered the cake to her. We just really bonded. And when I left the house that day, I felt my mom's presence. I'm forever grateful to hospice. So I just, want to pay back the compassion and care that was provided to my mom and my dad.
It means a lot to be able to give back, not only to hospice, but to fellow veterans who have served our country.
I think of all of the meaningful moments with hospice care and my father-in-law. I think the We Honor Veterans program was the most meaningful for me. I think for most people who are dying, the loss of dignity is a tremendous loss for everybody. But when they are there thinking about their time on service, we reignite that dignity that has been lost, and it's so special. To be able to see him smile for the first time in a long time, and he was so proud, and it was really moving for all of us. And then he died 2 days later. So it really was the last lucid moment for him, and the last moment that we could all really enjoy seeing him alive.
Bereavement support is an integral part of hospice care. It's something that hospices are required to provide, but there's not really a good mechanism for insurance reimbursement for bereavement care. That's one of the places that donor support can make an enormous difference in helping people to process loss and to heal after their loved one has gone.
Lived experiences are what tie us all together. And now I can say I have the lived experience of not only having witnessed the team take care of a loved one, but it's the same team that I will be working with. And so I can look at my patients and families and say with confidence, you will be taken care of by the best team, and know that that's true because I experienced it myself.